Hi, my name is Dr. Kathleen Albrecht, and I'm an ophthalmologist. My subspecialty is ophthalmic plastics and reconstructive surgery at Prisma Health. So I trained at Georgetown University Medical School, which is where I went to medical school there, and then I went to Northwestern University for my internship, and then to the Doheny Eye Institute, which is at USC and UCLA in California. Ophthalmology is the study of the eyes, dealing with vision, the structure of the eyes, and also the surrounding tissue of the eyes, the eyelids, the bony orbit that is behind the eye, the optic nerve, and the facial muscles that interplay with the eyes in terms of opening and closing the eyes. I am also a subspecialist, and my subspecialty is ophthalmic plastics and reconstructive surgery. That's a 2-year fellowship that deals with the tissues that support the eye, the eyelids, the inner working of the brow, the back of the eye, which is the orbit, and it encompasses problems like dry eye, tearing, droopy eyelids, droopy upper and lower eyelids. It also encompasses mostly functional surgery, but some cosmetic surgery. I like to listen to people's questions first and hear their concerns. That gives me the pathway to sort of understanding, first seek to understand, then be understood. So some people are more receptive than others to hearing description of what the problem is. It's very easy to sort of gloss over dry eye problems, but dry eye problems cause an enormous amount of pain and problems for people. It's very important that people understand the underlying problems with production of tear and oil, because this is something in which they'll have to treat themselves with a daily kind of hygiene and regimen that will do a lot to make their eyes comfortable. So depending on the person's problem and sometimes how much anxiety or worry they have with it, that will inform me how much I need to talk to them to make them comfortable so that they could ask me questions. But I love being able to take something that was really kind of complex with big medical terms and make an apt kind of analogy to be able to make people understand. The more I can destigmatize a problem for somebody and make them see that it's really very worthwhile to take care of their vision and their health, because taking care of your overall health improves your vision. In my free time, I actually do volunteer a lot. I worked with the Big Brothers and Big Sisters in Chicago for 20 years. I did a lot of community outreach through my church. I also, I love to read. I'm an avid reader. I'd be happy in a nook with a book all day long. I love the outdoors. I recently went to South Africa, went on safari, so I love to travel, but I'm a very avid musician. To make an appointment with me, please call the number on the screen.